La prochaine question est de Boris Prou.
Next question from Boris Prou from Le Devoir.
Bonjour, j'aimerais savoir ce que vous
Good day.
pensez des annonces des
I'd like to know what you think about announcements from provincial governments, including the Quebec government, reducing the lockdown or quarantine time to 5 days. From your point of view, is this appropriate or is it dangerous? Minister Duclos, I will quickly answer and give the floor to Drs. Tam and Njoo. On rapid testing, there's something I would like to clarify. Of the 140 million rapid tests that will be delivered in January, 31.5 million of those will be delivered to Quebec because it is based on a per capita numbers. Quebec has also requested higher numbers of rapid test deliveries recently. And as for the question, I will invite Drs. Tam and Njoo to reply.
Okay, bonjour.
Dr. Njoo, good day. I can begin to respond to the question, and Dr. Tam can always chime in. We are always in conversation with our counterparts in the provinces and territories because we know what the current situation is. That is, the Omicron variant is everywhere in the country. We're seeing cases everywhere. And public health's goal is always the same, to reduce disruptions in our society, reduce serious cases, and to reduce disruptions for our health workers. We are also in touch with the CDC in the United States, and we also take into account accommodations for public society. So the situation continues to evolve. We continue to base ourselves on the data. And yes, it is a challenge to strike a balance between what we know about the contagiousness of the virus and the functioning of society. And that is the same current issue being faced by provinces and territories. The authorities in the provinces and territories know their own context best, and it is up to them to strike a balance. As for us, we remain in constant communication with our provincial and territorial counterparts. And I would say to you that it is often a question of risk management and deciding one's tolerance to risks. For example, do we want to lock down confirmed cases for 10 days? Yes, that is always ideal, but it is not always possible given the current situation. So what about 5 days? Yes, 5 days of lockdown usually is possible for most contaminated individuals, but even with the 5 days of quarantine, contagiousness is possible after that. So we will continue to discuss this matter and try to strike the best balance. Thank you. My follow-up question will be for Minister Duclos. Do we have details on rapid tests? Will they be delivered in boxes of 20? And do you know what the delivery calendar for January will be for deliveries to the provinces? And do you accept any responsibility in the shortage of rapid tests in communities and in pharmacies? Answer. Thank you very much for the 3 separate questions. The first question was about the delivery boxes. There is quite a variety of types of rapid tests that have been requested and that are therefore being delivered to the provinces and territories. I do not have the details with me, but traditionally, each province or territory selects a variety of different boxes. And the provinces and territories' requests must be treated equitably. The deliveries will not change. They have worked the same way for the last year. As for the different types, I do not have those details. I would have to consult my officials. There is a very large quantity of tests being delivered, several million for Quebec only, just this week. And for supply chains, we prefer to confirm a delivery once we have been able to confirm that the delivery is completed on the ground. And as for the final question, as I've said and as others have said, over the past weeks, provinces and territories before December 2021 were facing quite a plethora of challenges.
Que les provinces et territoires devaient privilégier. Ça a changé beaucoup à partir du début du mois de décembre. On est passé d'une moyenne de 7 millions de tests par mois qui étaient demandés à 35 millions livrés en décembre.
At first, they were asking for an average of 7 million tests, which has substantially increased. So the requests for rapid tests from provinces and territories has quickly increased. And this is true for all provinces and territories. And I would say that good faith and great cooperation is true for all provinces and territories.
Try to keep the responses as tight as they can just because of the time. One more on the phone, operator, a single question.
The next question is from Stephanie Levitz from the Toronto Star. Please go ahead.
Good afternoon. Thanks for taking our questions. My question is for Minister Freeland, and it relates to benefits, sort of a pickup on a thread I asked you when we saw you the last time. There's lots of businesses now in the country that are facing pretty significant labor shortages due to COVID isolation requirements. So they're not being forced into lockdown. They're not being told to reduce capacity. The issue is that their staff are off work, having to isolate because they have COVID, a child has COVID. For these businesses in particular, are they eligible for any of your existing support programs, or are you considering any new or changes to these support programs to address this reality that some businesses are just forced to close, again, not because they're ordered shut by public health, but because they simply don't have enough staff to run their operations?
Thank you for the question, Stephanie. The specific so there are two levels, actually 3 levels of support for businesses that are available right now. And I do want to emphasize to businesses that are listening, these measures are available. The wage and rent subsidies will be paid retroactively for each period as they have been previously. So this is support that's there, the portals are there, and you can count on it. There are 3 levels of support. The first is the lockdown support. So if you are fully closed down or subject to that restriction of 50% or more, you qualify for the wage and rent subsidy. And there is that rent subsidy 25% top up if you are fully locked down. So that's one form of support. There's the support for tourism and hospitality as per C2. And then there is the hardest hit business support. And the tourism and hospitality and hardest hit business support does not require that you are subject to restrictions or lockdowns. But for that specific category of businesses, Stephanie, that you mentioned, who are not subject to any particular lockdown or restriction measures, nor are they in tourism and hospitality, the way they could qualify is if they find themselves in a hardest hit business category. So if they have a revenue fall for whatever reason, and a shortage of workers could be that reason, they could be covered by that provision.
Great. Glenn McGregor, please. Staying in the room, Talia.
Glenn McGregor, CTV News. Question for the doctors. The Food and Drug Administration has approved booster shots for those ages 12 to 17. Just wondering where we are on that in Canada, when we might expect boosters to be authorized for that age cohort.
It's Theresa Tam. I don't know if the minister wanted to take that question, or would you like me to go ahead?
Well, Dr. Tam is obviously signaling that this is belonging to the regulatory branch of Health Canada, which is outside of PHAC, and the regulatory branch is obviously an independent branch of the political office of mine. But we'll come back to you with a more precise answer.
Yeah. I would just add that we will be, of course, having ongoing discussions with the National Advisory Committee on Immunization. The way I understand it, there is actually no specific data being submitted by the manufacturer, which is how the regulatory authorization usually works. So it may be a bit different between Canada and the United States as well. And for sure, we can get back to you from a Health Canada perspective. But right now, of course, the key is to get the initial doses into the arms of the younger children, as well as getting the boosters, particularly for the higher risk.
Stephanie Taylor, CP.
Yeah. Question for Dr. Tam. I want to know what she thinks about Ontario and other provinces moving to 5 days isolation instead of 10, and the direction like Ontario has, for example, where there's not a lot of information provided to close contacts. Is this a smart move when you're infected with COVID-19? Is this not a smart move? I'd like your reaction.
Yes, I think Dr. Njoo had also provided an answer to that question as well. And we're discussing all of this with other chief medical officers of health and sharing information across the country. Of course, we're still learning about the Omicron virus, and that things like the incubation period or the period during which people can be infectious. So all of that is a sort of scientific foundation. And there's still a number of uncertainties. And there's, of course, the most precautionary approach, which is taking longer isolation and quarantine periods, but recognizing that there's realities of keeping society going, particularly the health system, as well as other critical infrastructures. And those are the difficult decisions that provinces have to make. And so right now, because of the sheer volume of cases, provinces are no longer doing individual case and contact management. That is just not possible for the public health system, and they're focusing on the high-risk settings where they will pay much more diligent attention to chasing up contacts, etc. So that's just the reality, and therefore there's general messaging to the population in terms of what you should observe if you're a case or if you're a contact, and So I think, 5 days of isolation, is that long enough? Well, if you wanted to be very precautionary, and some provinces are at the moment, you may take a longer isolation period, but this is a balancing of the risks versus the need to protect your critical infrastructure. And of course, for any members of the public, you have to wear your mask, well-fitted, and observe all the other measures really diligently, even if you're coming out of isolation and the quarantine period.
Tom Perry?
Hi, Dr. Tam. It's Tom Perry from CBC. I was just wondering if you have any concerns about the ability of rapid tests to detect the Omicron variant. What do we know about that at this point?
I think there's still data coming in, but some of the rapid tests will detect the Omicron variant. The difficulty with this particular virus is just how quickly people may develop the infection post-exposure, and things can shift really fast. So one just has to remember that if you tested negative in the morning, that doesn't mean that you may not test negative later on. And if you, depending on what setting you're going into, you're going to have to do very frequent rapid tests, depending on your particular individual situation. So that's a challenge really with Omicron.
And Abigail Beeman has our last question.
Hi, I'm wondering if you can update on any conversations around changing the definition of fully vaccinated to include a booster. I know this question gets asked from time to time. Is there anything new to share?
Yeah, it's not at this point. I think from a federal perspective, as we look at the international border, for example, we know that most countries in the world haven't had the benefit, some of them not even an initial course of vaccine, and that a booster is not accessible to most. And I think that we will be revisiting this question again after our booster programs have rolled out significantly in the domestic context. And we do know that there's evolving international knowledge about the effectiveness of the vaccine. And the most important thing about the vaccines that we have are that 2 doses offer substantial protection against severe outcomes, and a booster dose can increase that protection as well. But this vaccine, the vaccines we have globally are just not as good as reducing infection rates with the Omicron virus, even though it can be boosted somewhat with a booster dose. And so at the moment, the definition of what fully vaccinated means from an administrative perspective hasn't changed.
I'd like to thank the Deputy Prime Minister, Minister Duclos, Dr. Tam, Dr. Njoo. Thank you very much for today. That's all from the Parliamentary Precinct in downtown Ottawa.